Good evening, everyone. I'm Christy Casciano.
I'm Jeff Kulikowski. Those promising results from 2 different coronavirus vaccine trials are starting to give people a hopeful end to this pandemic.
And the furthest along in the process is Pfizer's vaccine, up to 90% effective based on early results. Moderna's is up to nearly 95% effective among its 95-person study, which will be part of the data submitted to the FDA. After the shots are approved, News Channel 9's Andrew Donovan asks Upstate Medical University for its plan once they arrive.
And I'm wondering if you have a date that Upstate will be able to say we're prepared for a vaccine if it arrives today.
I believe that we would be prepared to receive the vaccine if it was made available to us today.
Upstate's head pharmacist is ready for December, the earliest the FDA could allow proven vaccines to ship. On the receiving end, Upstate will need to store 2 doses for each patient. Some vials nearly 100 degrees below zero.
Based on what we know presently, it's the Pfizer vaccine that requires the deep freezer, the -80 storage, and the Moderna only requires freezer, normal freezer storage.
Upstate can store thousands of vials, but ordered additional freezers to hold exponentially more, not knowing if 100,000 doses for the entire region should be expected or just enough for its staff and patients.
We're pretty much planning for both and waiting for the guidance from our suppliers in the Department of Health as to how it would ultimately be disseminated.
The state plans 6 phases. First, high-risk patients like nursing home residents and healthcare workers will get the vaccine. Then lower-risk people and other essential workers. Then everyone else. Each group prioritized based on the local infection rate.
That specific planning is still in draft, through, potentially because we don't know how the vaccine is going to be distributed and in what quantities over what sequence of time.
This pharmacist has a lot of questions, but he's ready to act based on multiple answers. In Syracuse, Andrew Donovan, News Channel 9.
And the director of pharmacy services tells Andrew his next question is, how long will the vaccine protect people, and will it need to be given every year like a flu shot?